Hi there, my name's Rebecca, and did you know that 1 in 5 American adults struggle with a mental health issue? And that's according to the National Institute of Mental Health in a 2019 study, which can be found on their website. I want you to imagine the situation. You and 4 of your closest friends decide to go to a party tonight. Unfortunately though, one of your friends starts having a mental health episode at the party. It starts making a few of the partygoers uneasy, and one of them even mentions calling the police. Well, how do you feel in that moment? Would you want them to do that? Because for myself, I wouldn't want them to. As someone who struggles with mental health issues, and with many people in my life who do as well, I really wouldn't feel comfortable with that. Because when you have a heart attack, you have someone who has all the appropriate medical training and the right tools come to you and provides you support. But what if when you have a mental health emergency? The police who are specialized in preventing crimes and carry a weapon aren't necessarily the right people for the job. So today I'll be discussing policing alternatives to address the mental health needs of our community. I'll first discuss the state of mental health in Alabama, how the prison system has absorbed these problems caused by the lack of mental health infrastructure, and lastly, models that seem promising. All right, so let's first discuss the state of mental health in Alabama. According to a survey conducted by the Alabama Department of Health, which is titled Mental Health and Substance Abuse, which can be found in their website, Alabamians state that mental health and substance abuse as their second greatest concern for the state. And out of all 50 states, Alabama ranks 6th highest amongst the states for those struggling with depression. And that's according to the same survey conducted by the Alabama Department of Mental Health. Also, according to Mental Health America, in a 2020 survey, Alabama ranks 8th highest for prevalence of mental health issues, but ranks in the bottom 5 for access to care, which really just demonstrates the overall need for Alabama, our home state, to really take a look into expanding its mental health infrastructure by mostly investing into things such as crisis diversion centers and overlong preventative and immediate care. So now that I've discussed some information about the state of mental health in Alabama, let's move on to how currently the prison system is absorbing those issues. In 2019, the Alabama Department of Mental Health released a report titled The Cradle to Prison Pipeline in 2019, which more or less summarized how people born in poverty often have a trajectory of ending in prison, which leads to sometimes even an early death. And this also really emphasizes our desperate need to think of a different way. In this report's findings, it says that 85% of the brain is developed by age 5, but only 14% of the national funds for public school goes into those early years. 80% of children with anxiety disorders and 60% of children with depression are not receiving treatment. And Alabama currently spends $495 million on incarcerated adults, and out of that, $103 million is being spent on those with mental impairments. So the Alabama Department of Mental Health made a few recommendations in this report, including to redirect individuals with mental health and severe emotional problems to mental health court, but also to provide quality treatment, especially in the early years. So let's talk about some models of care that are a little bit different from what we're used to hearing from here. I'll firstly start with a program that is called CAHOOTS, which stands for Crisis Assistance Helping Out on the Streets. And this started in Eugene, Oregon. It's been going on for several decades now, for over 30 years. And essentially it models in the way where they have a crisis diversion team made up of a crisis worker and a medic who are dispatched to non-violent behavioral calls. And in a interview which is featured on npr.org with some of the CAHOOTS employees, they state that out of the 24,000 calls made in 2019, only 150 times were police called for backup. And not only does this system provide these people experiencing crises access to long-term care, because that's one of their end goals, is to get them into other programs, but it's also estimated to save the state a lot of money because it is taking the strain off of police. And the program director, Brubaker, estimates that the program saves $15 million a year by ER prevention and also by having taken the strain off of police response. And out of all those 30 years, it's estimated that no one has been injured as a result of the response team. And so it's in the interest of community health and also the state finances to invest in a crisis diversion team. So not only are we not exhausting the police, but we are providing real and adequate care to the community. There's also a lower risk of bodily harm for when a crisis diversion center is dispatched because they're not armed, which is going to make escalation less likely. Not only that, is many people would be more likely to cooperate with unarmed crisis workers as opposed to police because they know that they're not trying to arrest them. And in addition to that, many people are more likely to actually reach out in their time of need because of the well-established distrust in certain communities with the police in the United States. And other cities such as Denver with the STAR program have also modeled this off of Eugene's program and have had a lot of success. And that's also found in another NPR interview, but this time with Denver officials. So let's review everything today. We learned about policing alternatives that benefit community health. So you learned about the state of mental health in Alabama, how those issues are being absorbed by the criminal justice system, and a different model to respond to mental health crises. So the data shows that these systems are effective in helping the community and saving money. So it's really a no-brainer that we should be adopting these policies. So instead of paying out into a criminal justice system that isn't actually addressing the root of these issues, why don't we invest that into addressing the needs of our community's health? Because the happier, the healthier, right?